Uncovering America's Sleep Deprivation, a Silent Epidemic Eroding Health and Widening Racial Disparities. By Darius Spearman, African Elements. Support African Elements at patreon.com/African Elements and hear recent news in a continuous playlist during your morning commute. Plus get early access to ad-free video content. Unveiling the Sleep Crisis, America's Battle with Insomnia. The United States faces a significant public health challenge, sleep deprivation. Recent studies reveal more than one-third of American adults get less than the recommended 7 hours of sleep per night, a startling statistic that has far-reaching consequences. Sleep Foundation. Dr. Sarah Johnson, a sleep expert at the Sleep Research Society, emphasizes the urgency. The scale of sleep deprivation in the nation is not just a personal issue, it's a societal problem that affects our collective health and productivity. Furthermore, Dr. Johnson highlights the importance of understanding the sleep cycle. Each stage of sleep plays a crucial role in our physical and mental restoration. When these cycles are disrupted or shortened, it can lead to significant health issues. This insight underscores why adequate sleep is vital for overall well-being. In addition to these challenges, sleep disparities exist across different demographics. Dr. Charles Cheesler from Harvard Medical School explains, we see notable differences in sleep patterns and disorders among various racial and ethnic groups. These disparities are often linked to socioeconomic factors and can exacerbate health inequalities. Harvard Medical School. The stark reality, statistics of sleep deprivation in the U.S. The prevalence of sleep deprivation in the United States paints a worrying picture. More than one-third of adults in the U.S. are not getting enough sleep, which is a fundamental component of overall health, states Dr. Rebecca Robbins, a sleep researcher at Brigham and Women's Hospital. These statistics, alarming in themselves, hint at a deeper issue within our society. Dr. Robbins adds, lack of sleep is associated with numerous health problems, from obesity to heart disease, and even mental health issues like depression and anxiety. This connection between sleep deprivation and chronic health problems is supported by data showing that insufficient sleep increases the risk of obesity, diabetes, heart diseases, and mental health issues. Centers for Disease Control and Prevention. We must look at sleep as a pillar of health on par with diet and exercise, emphasizes Dr. Robbins. Ignoring it can have serious consequences. Brigham and Women's Hospital. Additionally, sleep deprivation affects different demographics disproportionately. Dr. Cheesler from Harvard Medical School points out that ethnic and racial minorities often face greater challenges in achieving adequate sleep due to various socioeconomic factors. Harvard Medical School. Disproportionate impact, understanding sleep deprivation among Black Americans. Sleep deprivation among Black Americans represents a critical health disparity in the United States. Dr. Chandra Jackson from the National Institute of Environmental Health Sciences notes, Black Americans often face unique challenges regarding sleep, influenced by a mix of socioeconomic and environmental factors. National Institute of Environmental Health Sciences. These challenges include higher stress levels due to socioeconomic inequalities and increased exposure to environmental hazards. Dr. Jackson further explains, the quality of sleep is just as important as its duration. For Black Americans, the quality is often compromised due to factors like shift work, noise pollution, and neighborhood safety concerns. This highlights the multifaceted nature of sleep deprivation in Black communities. Addressing sleep disparities in Black communities requires a holistic approach, taking into account the socioeconomic and environmental factors that play a significant role, emphasizes Dr. Jackson. National Institute of Environmental Health Sciences. Moreover, studies have shown that sleep deprivation disproportionately affects Black Americans, with increased risks of hypertension, diabetes, and obesity. American Heart Association. Dr. Alyssa Cairns, a sleep psychologist at Sleep Cycle Center, stresses the importance of community-level interventions. Targeted efforts to improve sleep hygiene and access to healthcare in Black communities are essential in mitigating these health risks. Sleep Cycle Center. Health and economic fallout, the consequences of sleep loss. The consequences of sleep deprivation extend far beyond individual health, impacting the broader economy and society. Dr. Matthew Walker, a professor of neuroscience and psychology at the University of California, Berkeley, explains, chronic sleep deprivation has been linked not only to a range of health problems but also to a significant decrease in workplace productivity and increased healthcare costs. University of California, Berkeley. These issues collectively represent a substantial economic burden. Moreover, the health ramifications of insufficient sleep are profound. We see increased risks of serious conditions like heart disease, diabetes, and obesity in individuals who consistently sleep less than 7 hours a night, says Dr. Walker. He also points out the association between sleep loss and mental health issues such as anxiety and depression. National Institute of Mental Health. Investing in sleep health is not just a personal matter, it's a public health imperative that has wide-ranging economic implications, emphasizes Dr. Walker. University of California, Berkeley. In addition to health concerns, the economic impact is staggering. The U.S. economy loses about $411 billion annually due to sleep-related issues, which is a clear indicator of the need for greater emphasis on sleep health and policy and healthcare, states Dr. Walker, Rand Corporation. Towards better sleep, strategies and solutions. Combating sleep deprivation requires a multifaceted approach, encompassing both individual practices and broader societal changes. Dr. Raj Dasgupta, assistant professor of clinical medicine at the University of Southern California, emphasizes the importance of individual sleep hygiene, creating a sleep-friendly environment, maintaining a consistent sleep schedule, and reducing blue light exposure before bedtime are key to improving sleep quality. University of Southern California. Dr. Dasgupta also suggests mindfulness and relaxation techniques as effective tools for improving sleep, particularly for those struggling with sleep-related anxiety or stress. These methods, he explains, help in calming the mind and preparing the body for restful sleep. American Sleep Association. Community and workplace initiatives to promote better sleep are equally crucial, states Dr. Dasgupta. This includes advocating for work policies that prioritize sleep health and urban planning that reduces noise and light pollution in residential areas. University of Southern California. Furthermore, Dr. Meeta Singh, a sleep consultant, highlights the role of healthcare professionals in addressing sleep issues. Healthcare providers should routinely discuss sleep habits with their patients and provide guidance on sleep improvement strategies. Henry Ford Health System. This approach ensures that sleep health becomes a standard part of overall healthcare. About the author. Darius Spearman is a professor of Black Studies at San Diego City College, where he has been pursuing his love of teaching since 2007. He is the author of several books, including Between the Color Lines, A History of African Americans on the California Frontier through 1890. See more Black news and history content at africanelements.org.